Jumper's knee. Most serious jumpers get it at some point, and almost none of them know how to deal with it. And most end up making it worse. That's because a lot of the information out there on jumper's knee is just plain bad. So in this video, I sat down with knee health expert Jake Tuura to break down what actually works for rehabbing jumper's knee. So that way you can get out there feeling strong, healthy, and jump your best.
Jake, tell us a little bit about yourself. What is your background? And yeah.
Yeah. Okay, so yeah, we talked off air that I'm not a big track and field guy. Never have been. I've just always been a basketball. I just love basketball. So I just always been a bad athlete. Like anyone who goes into strength and conditioning, bad athlete found benefit from lifting weights. Yeah, I mean it helped me in basketball be more powerful and jump higher and stuff like that. But I think after my senior year of high school, I got jumper's knee, patellar tendon pain, because I was trying to just jump higher and dunk. I don't think I could consistently dunk at the time. And I went the medical route for patellar tendon pain, and it was just a lot of resting, a lot of low level physical therapy. I got imaging. I had a partial tear in the tendon, which in hindsight is questionable whether it was or it was just like regular degeneration of the tendon. Got surgery, that didn't help. So I just kind of gave up on jumping for like 3 years and just got big and strong and went the route of a strength coach. So I got my undergrad and got my master's. And then I started training basketball players when I got a job at Division 1 sports. And I realized I shouldn't just be a fat powerlifter who's like big and strong. I should get back into what I love, which is basketball and dunking. So yeah, just kind of a few pieces fell together. Like I started posting on Instagram about kind of getting back into dunking and found out some stuff about isometrics and tendons, and I was like, things I had never seen before in my undergraduate graduate education. There's nothing on tendons. Going through physical therapy, I learned nothing about tendons. The medical route, talking to doctors, learned nothing about tendons. So yeah, it was all self-taught, and I think it's been about 5 years now of looking. I guess for the last 5 years, all I've really cared about is what's going on with tendons and what's going on with the patellar tendon, I guess with the quad tendon. Yeah, in the past 5 years, probably before 2020, I knew nothing about tendons. I was advising no one on tendons. I didn't have any programs, and now that's like the biggest thing for my business is helping people navigate through patellar tendon pain. And then on the little side project is like digging into the science to see if there are any answers in the science of what's going on, which often there are not. And really, you just take it a day by day with someone. You try to improve their function. You try to pay attention to pain. It's not a very scientific rationale for what's going on with the pain because we kind of just give up and we're like, I don't know what's going on. Let's just try to get this person better. So yeah, that's kind of where I've been. Again, not a track and field guy, but like I love jumping. I love dunking basketballs, and I think a lot of things I get there and the people I work with there, it's just going to translate over to anyone who is a jumper.
Perfect. Well, everybody like is human. All knees are like mostly the same. So hopefully a lot of that knowledge from the basketball world and other sports can translate over. So I just wanted to go ahead and get rolling on the questions. And the first question I wanted to ask is a lot of us are stuck in like cycles of pain where they go out, it gets worse, and they can't walk downstairs after a competition or practice. And they just don't know how to get out of this cycle of just re-aggravating it and it getting worse or just staying the same. And what would you say is like the first step to kind of start getting out of that cycle for any sort of athlete who is like experiencing like knee pain? Is it isometrics? Would you do like you mentioned isometrics, like sled walks, or would you take rest, keep going? What would you think?
Okay, yeah. I think if you take someone like that who's in the pain, who has the knee pain, maybe we can just generalize and say knee pain because there's a bunch of things. Could be patellofemoral pain, could be quad tendon, patellar tendon. Like basically, you just have the knee extensor mechanism is compromised. Like there's something going on there that's causing issues, and then you're getting the pain during the activity or after or the next day. So, I yeah, you just have something going on in the front of the knee that's really limiting you. So I think before I would go to like what someone should do, I think they need to look at what's causing the problem. And it's really only two things. It's it's the function. So the function of the front of your knee, the function of your quadriceps and everything running through the knee, the function is not good. Like you're probably not happy with the function of your knee, of that bad knee. And you're not happy with the pain levels. Like the pain levels are not acceptable for you. So it's like, I think if you keep doing, if you're in that state of it's not functioning well, like you're not jumping any better, you're probably jumping worse because of the pain. And the pain just keeps getting, the pain just stays and it's not acceptable for you. Maybe it's getting worse. I still tell people stop jumping is number one. Like if you're in that, if you're on this downwards trend of worse function and more pain, and that's like a weekly thing that is getting worse and worse every week, stop jumping. Yeah, maybe I don't know the if that's feasible for someone, like depending on if they're in season or if they have competitions coming up. Maybe it's just something where it's like, because pro dunkers will do a bunch of shows, or they'll do a bunch of shows in a row, and they'll know that they're going to be getting bad patellar tendon pain, but they just keep jumping through it. They just warm up a bunch. They do like isometrics to do little things to try to put a band-aid over it, but they know they're going to really be limping the next day, or they're really going to be hurting. But there's like a light at the end of the tunnel because it's going to be over soon, and then they can stop jumping, and then they can go back to rehab. So I think it depends on the spot that a person is in, but you have to always just look at it from the function and the pain perspective. That I talk about the function and the pain perspective because it has to be both. You have to keep in mind the function. What is your performance like? And you have to keep in mind the pain, because if you just wanted to decrease the pain of the knee, just don't do anything. Just stay in bed all day and your pain will go away, but your function will also go away. So that's not good. And if you just pay attention to the function and you're like, you do have people that can function just fine with bad pain. If you just pay attention to the function, you're like, I'm doing just fine, but the next day I can't get out of bed and I can't like walk downstairs. Like that's not good either. So it's like you need to pay attention to the function and be like, what are my numbers at? What also goes into function is my quadricep as strong on this side as the other side? Is my quadricep wasted away? Are my calves? Is my ability to perform like hopping tasks limited on one side versus the other? Strength testing, is it weaker on one side versus the other? That all goes into function. So like you have to keep tabs on the function. So the whole rehab process, I think you need to start with that and take someone where they are on that given day, and make that call of like, do you need to stop jumping and do we need to completely rehab? Or is the pain not that bad? Is it okay for the person? Is their function really not taking that big of a hit? And can we just add in some rehab exercises? So in that case, I think you can just add in isometrics. Like that, as easy as it is, just add in. And I think a good time frame for those people dealing with that pain is like a few times a week. You could add in, let's just say 5 sets of like 30 seconds or 45-second isometrics, because that's
Mhm.
going to hit that quad. When your knee starts hurting, your quad starts to waste away. Your brain doesn't want to activate the quad anymore. And the isometric is a great thing to do because there's no hiding. There's no hiding the quad when you do an isometric.
And can you give us a little bit of like our audience a little bit of background on what an isometric is?
Yeah,
Just like
yeah,
a
yeah, yeah,
brief.
yeah. So I guess if you look at jumping, the activity of you said long jump and then triple jump is like the loading is so fast. It happens so abrupt, and the forces going through the tendon and through the front of the knee are so high. So it's really high forces and it's really fast. So almost what you're doing with an isometric is the opposite. Is you're taking away the speed of everything and you're just doing like the lowest speed possible, which is holding a position. And if you hold it for a period of time, you can get some effects with so everything in your body has fluid. So like there's a viscoelastic properties of things. So whenever you're doing the long, this is how I understand it right now. Whenever you're doing the long jump or the triple jump, um, all the components in the tendon kind of stiffen up. Like there's a lot of fluid in there, and it kind of gets trapped in there, and everything stiffens up, and that's what allows you to, I guess, be like have like a stiff spring or a stiff rubber band action of the front of your knee. So you have all the fluid that stays in and stiffens up, and then you get this action happen. When you do a slow isometric, you actually get this squeezing out, like a wringing out of the water, and the components within the tendon, within the front of the knee, can kind of shuffle around one another. So you're getting good load through, almost like it's homogeneous load, like you're getting good load through the entire front of the knee or the entire tendon. Versus when you're doing the triple jump or the long jump, and you have a compromised tendon, you might only be loading certain regions, and then you might be compressing other regions. So sorry, it's kind of a tangent on the whole thing, but an isometric is just when you're holding a position. So you could think the easiest one is a wall sit. Everyone's done a wall sit. If you did a 2-leg wall sit against a wall and you hold it for as long as you can, like your quad muscles start screaming, and you're getting this like a slow elongation of the tendon, of the patellar tendon and the quad tendon, all while you're getting like shuffling around of the internal components. So like the unhealthy regions when you move fast are kind of shielded from the load, but when you hold an isometric, everything can kind of experience the load because things are shuffling around, water is getting squeezed out of the tendon. So it's just a really healthy stimulus. So going back to your idea of like what would I give to someone who's kind of dealing with that pain, and if they're not in the camp of stop jumping, because a lot of people are in the camp of stop jumping, you just gotta pull the plug on it and be done with it and let your body rest and recover, and do rehab. But the people that can still jump alongside it because it's not that bad, I think if they just add in some isometrics a few times a week for the quadriceps, because if you're talking about the front of the knee pain, the most important muscle group is the quadriceps. It's not the glutes and it's not the hamstring. It is the quadriceps. It's the thing that connects to the front of the knee. Like there's nothing else that is as obvious of a connection to the front of the knee. It's the quadriceps. So the quadriceps waste away. We need to get load through the quadriceps. So I like the time frame. This is kind of from Keith Barr and Ebony Rio. And for me, in the last 5 years, it's been a really good time frame that's worked for people of 30-second holds or 45-second holds, and do like 5 sets and get like a couple minutes rest. So if you take 30, I say 30 to 45 seconds because it's a good way to get like good load through the quads, like a good force output of the quads, which then is going to pull on the tendon. But if you did a time frame of, let's say, like 5 seconds, because people have done isometrics where they do as heavy as they possibly can for 5 seconds and they basically fail at the end of that. If you're doing like sit on a leg extension machine and push as hard as you can for 5 seconds and then you're kind of just tapped out at the end. If you have someone with bad knee pain, I think it's going to flare up their knee pain even worse. It's going to blow it up even more. And then if you do something like, let's say, a 2-minute hold or a 3-minute hold, for a lot of people, it's almost like too low intensity. It's almost too low intensity to where you're so far away from the forces that you're going to experience when you're going back to jumping. So kind of in the middle, I like the 30 to 45 second time frame, and I've kind of just been stuck on it because I've had so many thousands of people that have just followed it and it's worked well for them. So you kind of get on, if you're doing the 2-leg wall sit for 30 to 45 seconds, that should be easy for everyone in the world, basically, unless you're really detrained. So like that's not a good exercise. You can do a single leg wall sit, and you'll actually kind of fatigue the quadriceps at the end of 30 to 45 seconds. So that means it's a good thing because you want to take the set to muscular failure, which means you're getting this good load through the front of the knee and through the tendons. So that's a good one. Leg extension is a good one. Training one side at a time. Because again, like going back to hiding, your body's going to hide the quadriceps if the quadriceps are weak and and the knee's painful. Your body's also going to hide the painful side. So if you can train one side at a time, you can't hide anymore. So doing the single leg wall sit, you hit one side at a time. Doing the leg extension isometric, you hit one side at a time. There's other exercises like single leg press. There's some bilateral ones that can be good, but again, you could hide like the reverse Nordic, a Spanish squat. Those kind of cover the isometric for the quad that are scalable and loadable to make it more difficult. So yeah, those are kind of things I would add in. Like a few times a week, you could just add in isometrics. You could even add them in every day if you wanted, and you're gonna get your brain to activate your quad, basically activate your quad again, because when you've had the knee pain, your brain is like, I don't want to load that knee anymore, which means I don't want to load that quad anymore. And if you get on isometrics, it's like the safest way for the brain to be like, okay, it's okay to activate my quads again and for us to get the quads back. Yeah, those are kind of my thoughts around that. Yeah, so I think just adding in isometrics can be really useful for that camp of people.
So just to clarify, 5 sets a couple times a week would be like a good starting point for athletes who are in that cycle of pain to hopefully get back a little bit of that function and reduce some of the pain.
Yeah, exactly. Yeah.
Would that be addressing more of like the function or the pain side?
I think no, I think it's going to do both. I think it's going to do both. So like you're addressing the function because you're trying to one of the big pieces of function, which is not really measurable. Maybe it is, but not for anyone. It's like the brain activating the quads again. Maybe you can measure it if you just look at your quad on one side where the pain is, and it's smaller and it's like a soupy look versus the other one. You can actually see the muscle when you flex the quad, and the strength will be so much worse. So it's like you're just activating that quad in a manner where it's going to fatigue in like a 30 to 45 second time frame, and that's a functional gain. You're going to get a functional gain because you're just training something that's detrained, basically. So it is working the function. And then the pain aspect, I think, man, pain's difficult because tendon pain is difficult because you can decrease tendon pain significantly if you just warm up. Just doing a warm up, you can feel so much better. You can do an isometric for a warm up. You can do just whatever. If your activity is jumping, just do low intensity jumps and then medium intensity and then high, and you'll feel pretty good versus going right to high intensity jumps. So you can change tendon pain immediately from just warming up with anything. But the pain aspect I'm talking about, like we're trying to decrease pain over the long term, it can just take a while. It can take quite a while. And there are different camps of people. So like I don't want to get too confusing here, but there is a camp of tendon pain people where I think they get an abundance of fluid in their tendon, so the tendon kind of swells up and it gets like pressurized, and that's what the pain. I think that's the pain that these people are experiencing, and the best way to squeeze out that fluid is doing isometrics. I think it is doing isometrics. So if you're in that camp of people, there's really no way to know right now because this research is really new. I think if you're in that camp of people, you're getting the functional gain and you're getting the pain decrease because you're squeezing out the fluid. Now the fluid will come back in, but it's like you're getting a time frame. If you're doing it 2-3 times a week, you're getting that time frame of squeezing the fluid out. Now you have people that might not be the cause of the pain because they have a calcification in the tendon or they have further degeneration, and maybe it's not a fluid pressurization thing. Maybe there's like some impingement going on. I don't know exactly what is going on with their pain. So like maybe they don't have a big pain decrease from the isometrics like the pressurized people do. But I think over time you're going to get that. So pain decrease is a tough one with the tendons because some people can really get a long-term pain decrease in like a few days or a few weeks. And some people can take months and they can take years to get the pain decrease. So I think the best bet you have, I always tell this to people of like, they look at their function. If they've had long-standing patellar tendon pain, they look at their function and they've taken their leg extension ISO from like 20 pounds to 100 pounds, and they've taken their split squat from 20-pound dumbbells to 100-pound dumbbells or 50-pound dumbbells, whatever it is. They've seen this huge gain in function, and it's kind of stuck around, so they've had it for many weeks, but their pain is stable. Their pain has not changed, so it's still at like a 4 out of 10 and hasn't gone anywhere. And I tell those people, I'm like, I think the pain decrease is just going to be a delayed thing. I think it's just a delayed response to the functional gain. But you have some people where the reverse is true. Like they can get pain to decrease immediately. So this is the difficult thing with pain is I think there are different subgroups of types of tendon pains. Like your patellar tendon pain is probably not going to be the same as my patellar tendon pain. It's not going to be the same as someone else's. So to say like, is isometrics the best thing for it might be the best for me. It might not be the best for you. Mine might get better in a few days. Yours might get better in a few months. All you can really go by is what's the function like, and let's try to keep the pain stable. I think that's the best route to go.
Okay, nice. Because that makes a lot of sense. Because from what I know, like pain is just like a complex issue. Like there's not really one size fits all solutions to it in terms of like back pain, knee pain.
It is. And that's why like when you go to the front of the knee pain, like patellar tendon pain, it helps so much to have something like a leg extension isometric where you can test the strength on both sides. And you can see, oh, I did 20 pounds on my weak side and I did 100 pounds on my strong side. Like, let's just do that. Let's just start doing that a few times a week and see if that does it. Like, let's just bring the function up of that weak side. So like that's why I love looking at function, because it gives you something concrete and objective to go by, and then we're just trying to keep the pain stable. But man, so much of it could just be placebo, and so much of it could just be people losing their fear of the pain. I don't know what it is, but I think that's why focusing on function is so much better. Because if you focus on pain, you're going to be doing a lot of dumb things. Like maybe they're not dumb because some people might like them, but like you're going to try icing the knee, you're going to try like rubbing the knee with a tool, you're going to try like doing all this stuff to the tendon, and it's like I don't think there's really anything good you can directly do to the tendon. I think you should just focus on the quad that's above, which is mostly all of the time really deficient on that painful side, and leave the tendon alone and let the pain healing process happen very slow. And I think the reason it's so slow and so miserable is I think it's just blood flow. Like tendons get such bad blood flow. They get worse blood flow than muscle, clearly. They get worse blood flow than bone. And when you do get the tendon pain, you do get an increase in blood flow, but it's not significant. It's not significant, meaning it's going to be crazy accelerated. And you do get an increase in blood flow from exercise too. But it's like, I think it's just the 24-hour blood flow that is so small with a tendon. And it's like, that makes for a tissue that's very stiff and strong. But also on the flip side, it's going to regenerate very poorly when you set it off.
So like whenever it gets like kind of in a bad state or degenerative, it's harder to get back to like normal.
Yeah, and I mean, I have a hard time going to. Speaking of structure and pain is the same thing because when you say a degenerative tendon, it's going to be hard to get back. And like this is the thing that I don't know if so many people have a. I still try to wrap my head around it too. That like the structural degeneration is not reflective of the pain symptoms, and the structural changes that you get of like the tendon looking better on a scan or the tendon getting stiffer, that's not reflective of pain symptoms either. So it's like pain's just too complex. Tendon pain is way too complex just to bring it back to the structure. Because you have people, if you look at so like a rotator cuff tendon, one of the big things is as you get older, you're going to be more likely to have tears. But also, if you use your rotator cuff tendons a lot, you're more likely to have tears over your lifetime. So, like just the overuse. And if we take the jumpers that are listening to this, you have overused or you have abused your knee tendons. Probably, if you've jumped, you've abused them your whole life. It's just the nature of jumping that you could probably scan everyone's patellar tendons, and they're all going to look really bad on imaging, but not everyone's going to have pain. So it's like speaking of the structural degeneration and things like that, and then like conflating that to pain is just not right. But when people are in pain, they want to get scans and they want to see what the imaging looks like. And it can be good because you can pick out things like you could pick out if you have a tumor in your knee, or you could pick out if there's like a bone is chipped out. You know, you could find bad things, like really sinister things in your knee. But if you don't find those, then it's kind of like it's I don't know if it's anything to worry about. One tangent, my friend in Indiana, he is a WNBA player. Recently, he messaged me about she had a knee injury, and they went into the doctor right away and they got a scan of the patellar tendons, I think, and they saw the imaging report said like partial tears of it was just one side, I think, partial tear of the patellar tendon, and like it was a panic moment where like everyone's like, we need to scrap the rehab, and or no, we need to scrap training, and we need to really focus on rehab, and maybe we need to get surgery, maybe we need to get injections. And he called me like really soon after, and I was like, dude, they shouldn't have wrote that on the image on the reports. Like there are so many people that could have partial tears of their tendon on an imaging report because it just looks like unhealthy or it just looks bad. And I was like, I think you should just take it easy for a few days, like try isometrics, kind of things, same things I said here, and slowly get back to training. And that's what he did. And like she was fine after like a week, not completely fine, but like all this panic of the scary imaging reports and everything they wrote on there, all that panic was gone because I think she had that partial tear years prior. I think it had existed for a really long time because she had been dealing with knee pain in the front anyways. So sorry to go on that tangent. It's just hard to, people need to get out of their head that like the structure is going to be reflective of the pain symptoms. And it's just not the case. And it might feel like kind of overwhelming if that's the case, because it's like, well, then what is causing my pain? Is the structure irrelevant? And it's like, no, that's not really the case. That's why I always go to function, and I'm like, does the front of your knee hurt? Yes. Okay, what's your quadricep strength like? And it's like gives you something concrete to do, because usually the quadricep strength is going to be bad. If the quadricep strength is good, then it's like we have other things to focus on, which is probably like lower level plyometrics. And if you isolate one side versus the other, you're probably going to see that there's kind of a problem with the painful side, and maybe we could start at a level where it like regress everything to a very low level and then just progress over time. And I think that's the main lesson I have with the tendon pain is like when you have someone in the bad tendon pain, in the first case, you're trying to let it settle down. Like the body will naturally let it settle down. So let the tendon pain settle down. Try to take away some of maybe the frequency and the volume and intensity of the jumps. Let the tendon settle down. Maybe add in some isometrics. And then once it's settled down, then we can build it back up. So then you can start pushing the frequency, volume, and intensity. But that's like any musculoskeletal pain. It just rings true for tendon. That's like let the pain settle and then build it back up. It's like a 2-year-old could do this, but for some reason we want to think we need to do all these special tricks and use all these devices, when really it's like let the tendon pain settle, like let Mother Nature go about its own healing. And then when you're feeling good, regress everything down to a low level, start trying that, make sure that you're not getting more pain, make sure you can do everything with good technique and everything, and then just slowly build it back up. But this requires a ton of patience, and that's kind of a hard thing. A lot of people might not have that.
Yeah. Those light plyometrics is something that my coach, I know you talked to him about tendons a lot, Matt Watson. He harps on that a lot, just like regressing it to a level that you can handle he sees a lot of value in like higher volumes of lower level stuff for those tendons and building it back up slowly if you are getting back to sport from an injury. A couple things I want to point out was like, so right now, track athletes, they're coming out of the indoor season and going into outdoor season. So we're like right in the middle of the season. A lot of people are going to be just trying to maintain their levels right now. They're not going to be able to take that rest. So some key takeaways I've taken is warm up the tendon, that you can like have a lot of relief from just having a good warm up, maybe doing isometrics before your practices, before your meets. And then isometrics, like you said, five sets of the 30 to 45-second holds can also provide a lot of, can address some of the like weaknesses, the strength and the pain. Are there any other like considerations that you would have for athletes who are in season, they can't really take the rest? Like how would you handle rest maybe in between sessions or
Yeah.
meets?
Okay. So, yeah. Before I talk about that quad isometric, so like I've spoken so much about the quads because they are the biggest player. One thing I want to say too, because I've had this before. Before I get on to what you were saying, is people. I talk about like thorough quad development quotations, and you have like the three quad muscles, VMO, vastus lateralis, and then the vastus intermedius. And I'm like, anytime you bend your knee, you're good. Like you're going to be strengthening them. Anytime you're bending your knee or resisting something under load, like a leg extension, you're good. But then you have the rectus femoris, which goes to the hip. So like there is a hip involvement, and a lot of times if you're just doing squats or you're like seated on something, like you're flexed at your hip, so like there is value to doing something where you're more extended at the hip. So that's where like the isometric lunge or isometric split squat can be a really good exercise to get more thorough development of the quads. So I would add that in too, of like you could do 5 sets of 30 to 45 second just heavy quad isometrics, which would be like the leg extension, the Spanish squat, the single leg wall sit, stuff like that. But all those is where your hip is flexed. And then adding on top of that, I would do like an isometric lunge. We're just doing a lunge pattern. So that back leg, you're stretching the rec fem at the hip, the rectus femoris muscle. So it's like more thorough quad development. And I would just hold that for as long as you can, like 3 minute hold, 4 minute, 5 minute if you can. It's really not gonna harm anything because it's such a lower intensity, higher duration. But yeah, so that's what I would add in for like just talk. We spoke so much about the quads that I'm like, good quad development is those isometrics where you just like bending the knee, resisting something, but then also doing some form of a lunge or split squat variation to hit the rectus femoris muscle. And also the rectus femoris, there was a study where like most of the fibers of the patellar tendon of the anterior fibers were running off of the rectus femoris muscle. So I think that rectus femoris probably has the most involvement with the quadricep and the patellar tendon. So it's like, I think you want to try to develop that as much as you can. But when you talk about what do they do in season, I think it was Jill Cook. I first heard it when she was talking about tendon pain. And she said the three things that you need to play with are the frequency, the intensity, and the volume. And it was in that order too. That if you have a jumper who they're jumping, I don't know the frequency. How many is typical for them to like do high intensity jumps?
Usually about 2 to 3
Okay,
times a
two
week.
to three times a week.
Probably
Okay,
two.
so they're doing two times a week. That is pretty low actually. So like they're doing that is pretty low intensity. And again, the track field has probably figured this out already to avoid patellar tendon issues. If we were having this conversation like 200 years ago, I don't know when it started, like you might have people doing it 5 days a week, and then they probably run into so much patellar tendon pain or knee pain that it's like, maybe we need to try 4 days, maybe three, maybe two. So like maybe they've arrived at 2 to 3 days is like best practice, and maybe that's consistent across everyone. So she had said frequency, then intensity, then volume. So the first thing you could play with is the frequency. If you want to keep jumping and you're in season, you want to have those high intensity sessions. If it's 2 to 3 times a week that you're doing the jumping, let's say you're doing 3 times a week, if you just cut it down to two, now you give your tendon more time to heal. Because go back to the blood flow thing, like it takes so long for a tendon to go about a healing process. And when you do the max effort jumps, I think you're really just testing the tendon. You're not developing it at all. You're really just you're straining the thing as far as you possibly can. And that's a really destructive thing, especially for a bad tendon. So if you're at 3 days a week of doing that, you could just cut it down to two. And you're gonna get better. And then the other thing is the intensity. So it's the second thing you could play with is, let's just say you kept the frequency the same. So you're doing 3 times a week. You could just not jump with the intensity. You could jump at a lower intensity when you're doing practices. And then maybe when you get a competition, you could jump maximal. So that'd be a good way to let the tendon heal. And then the next is volume. So like if you're doing like 10 max effort jumps in a session, like cut it down to 5. And that'll let you heal too. So like you don't have to do all 3 of those at once, because then you're really going to be doing much less training. But if you were going to be doing all 3 and doing much less training, you could add a bunch of rehab on top of that, like a prehab rehab, to make up for all the volume that you're missing, which might be what a person needs. But yeah, those are the 3 big things. I think the frequency probably doesn't carry, like playing with the frequency might not be the best for track and field, because you guys have already done that. If I'm my world of basketball is like, you got people that play 7 days a week, and like they need to play with the frequency. So like you're playing 7 days a week and your tendon is just getting worse and worse. Let's cut that. Let's cut a day out, or let's cut 2 days out and just let it heal. But you guys seem like you're already doing that, because if you're only doing max effort jumps 2 to 3 times a week, those 2 to 3 times, those are the times that you're really going to be pissing off the tendon. If you're doing medium intense or low intense, you're not really pissing off the patellar tendon. It could actually have like a therapeutic effect. And you're getting blood flow, you're getting movement, which is all good things. So I think maybe the intensity and the volume is something that someone could play with in track and field. Of try to jump, maybe if you have 10 max effort attempts, maybe I'm so off on that number, 10 max effort attempts, maybe you just do like 2 max effort attempts, and then 8 of them are like 75% or something. So like that's a way to play with the intensity. And then you're also, I guess, playing with the volume a bit, but it's probably just trying to do a bit less so that your tendon can catch up. Because if it's really in that painful state, you just have to assume like it cannot catch up with the loads that we're putting on it.
Interesting. So you said it was frequency,
Then
intensity, volume. Nice. I love it. And then you said to address one of those at a time and not like
I think
all of
so,
them.
yeah, because it's like anytime you take away a bit of one of them is like you're kind of going to be detraining yourself. Like if you took away all 3 at once, what are you going to do? Like jump once a week and only do one effort to decrease the volume and also decrease the intensity, do it at 50%. Like, if you did all 3 at once, it'd be like you're getting. So that's the hard thing with tendon rehab, and that's why the individual approach is probably needed mostly all of the time, is just figuring out like how much do you need to take away, because you want to keep people active. You want to keep them doing stuff. Like if you look at the running world with Achilles tendinopathy, is like if you take a runner out of running for their Achilles tendon, it's really hard to get back into running, because if they took it away for a month, they're detrained for a month. Like with jumping, I know I said earlier, like stop jumping at the start, and those are for people with really bad pain who just keep pissing it off even more. But if you're not in that camp and you're able to keep doing it, you should probably keep jumping, because it's like you're now, if you keep jumping, you're keeping everything kind of like in shape. You're keeping the ankles in shape, and the Achilles tendon and the calves and the hamstrings and the quads to some degree, and the hips, and like you're keeping the coordination in. So like you don't lose the coordination, and then if you lose the coordination, maybe you start yanking on your tendons more, because your tendons are like just this. I think when you have bad coordination, just yank on tendons more in general. So when you take time off, everyone's felt it, like your coordination just goes down the drain and nothing feels as smooth anymore. So that there is a time for you to pull the plug on people, but there's also a really big negative to pulling the plug, because it's like you should be staying as active as possible, because there are so many benefits to just doing the thing that you want to keep doing for the rest of your life. When you stop doing it, it's so hard to get back to it. You can do it. It's just going to take a really long time, and you got to regress everything, and then you got to build it back up. And it's like, that takes so many months when you've really taken significant time off. I've had it for myself, because I tore my lat tendon, and I had a year or maybe a year and a half or something where I didn't dunk. And then I went to dunk, and I have a background in dunking, like probably 7 years of like dunking so consistently, so often, and no patellar tendon pain at the time. And I went to dunk, and that just blew up my patellar tendon like pretty much immediately after so much time off, after many months off. I think it was 10 months off. And I go just do like a regular old dunk, and it just blows up the patellar tendon, like hard to walk downstairs, hard to do anything. So like, once you take something away, and you have a history of tendon pain, that tendon pain is going to come right back when you go back to the max effort thing.
Okay. So for somebody that is in that camp of like, it's really bad, and after the season ends, like they need to take some time off to get it back to a like reasonable state. How would you like go about bringing them back into jumping if like, or how do you maintain that capacity?
Yeah, so
I guess.
it probably like starting with the end in mind when you have this, like starting with the end, which is like I guess the end of that rehab time of that off season is when like the practices start, right? So like you kind of keep that in mind. So then you kind of have some time frame of like how much time can we take off of jumping where we feel comfortable. Like if I could I take 2 or 3 months off and just do rehab exercises because like your quad has wasted away and like we need to spend so much time on strength work. That could be the case because then you're doing the strength work to build the muscles back up, but then that strength work is also going to hit the tendon, is going to build the tendon back up, and it's all pretty much in a non-painful, like non-provocative way. So like it's not going to piss off the tendon further by doing all that strength work if you do it right. But if you keep jumping, you're just going to keep aggravating the thing. So it's like maybe you want to take some time off, maybe like a few weeks, a few months, and having the end in mind. Because like, what if the practices just creep up on you, and then it's like, oh, I got to be ready to jump in a month, and I haven't jumped all off season. So that's what you want to avoid. That's why you got to start and kind of have this idea of this plan. So, and that's where I think like Matt Watson stuff with doing having the tiers, like as simple as that is, like the light tier and the medium and the pink tier is like with a lot of those people, you probably could keep some form of light tier work in. With even really sensitive patellar tendons, you probably could keep the light tier stuff in probably year round. And then like the medium, you could probably start as the season starts getting there. And then like the pink tier, maybe you really are gradual with getting into that. But it's a hard question because yeah, there are some people where I'm like, you should definitely pull the plug and just do strength work because your quads are so weak and your brain doesn't want to activate them. Your brain wants to shut down that whole knee. And if you keep jumping, it's just going to reinforce this bad pattern. So let's stop the jumping. Let's build you back up, get you back to like where your quad is strong and your quad is big, and then start to build back in jumping. But some people, you can probably just keep it in, keep some of it in. But yeah, I think that doesn't give specific guidelines, but it's that whole idea that starting with the end in mind and make sure that you don't have 1 week to prepare for something and you haven't done it at all. Like that's not a good case to be in. Because I think one thing with the tendon pains is like I know my friend Daniel Bach, he had a thing of like 30 max effort jump attempts for someone who's like over 30. He had a certain number, is what you should kind of stick to. And I love Dan, and I'm sure he's seen that with people he's worked with. But some of those things just never really like hit home with me because all the times I spend at like LA Fitness with basketball guys, and I'm like, there are people that are dunking every day of the week, and they don't have patellar tendon pain, and like they're getting away with it, and they just keep the loads in. They keep doing it day after day after day for many months and many years, and they never have problems. It's when they take time off that they have problems. It's when they take a month off because they just had a baby or something and they need to stay home, and then they want to get back to 7 days a week basketball. That's when the tendons start to blow up. So I think you can get away with a ton of volume and a ton of frequency and a ton of intensity. You can get away with actually probably anything in the world if that is consistent for you and you don't have like pain currently. So it's like I think you can do whatever you want to the tendons as long as it's a consistent load. Probably like weekly you're doing like the same exact, or maybe daily you're doing the same exact like volumes and intensities. You might be wrecking the tendon structurally, but the structure and the pain are not the same thing. So it's like, you can really abuse the thing, but as long as you're consistent, I think as long as you're consistent, that pain isn't going to come up on you. The pain's going to come up on you when you change things suddenly, when you take time off and then you come back to it.
That makes sense. So like whenever you do something different, that's whenever it like
Yeah, I think I try to
yeah.
actually think of what causes the tendon pain. And I think I might be wrong in this, but I think it's just when you pull on it too far, like you strain the tendon too far. And I think this is why when I go do a dunk, I can really blow up my tendon. If I'm doing a max effort dunk, I can really blow up my tendon. But if I just did like a ton of 75% jumps, I'm never going to blow up my tendon. It's when I really pull on it super far. So I pull on it a ton. That's when I can really set it off when it's not ready for that level of pull. And that's why when you change something, so like you could have a tennis player change their racket and it makes them pull on their elbow tendons a little bit different, or like a golfer can change something. I don't know what a golfer could instead of hitting the ground, which has some give, they can hit a mat on a concrete floor, and that can yank on the tendon a little bit too much. You could change shoes as a track and field person. You could change shoes, or a basketball, you could change shoes. You could change surfaces. All these little things can add a change on the tendon, and I think some of them sometimes can just cause this effect where you yank on the tendon a little bit too much. And I think it could be in one jump, or it could be in many of the jumps that are accumulate, and then that really sets off the tendon, and it's like you could trace back and be like, oh, I changed my shoes and that's why my tendon hurt. And I think the reason it sets it off is because you just pulled on it too far. You got in a position where you pulled on it too far, and it was because you changed your shoes, or because you changed the surface, because you're never getting more tendon pain when you go from a really hard surface to like a really soft surface. It's when you're going from a really soft surface to a really hard surface, which is you pulling on the tendon more because the time on the ground
Yeah.
is shorter. Just everything about it, and that's why I'm convinced it's just those blowups of tendon pain. I think it's just when you pull on it too much in a given jump or in many jumps that are heavy accumulated. And go back to the coordination thing. When you take time off, you could keep everything the same, the shoes, the surface, everything. But when you take time off, coordination takes a hit, and you're kind of moving like you're just moving uncoordinated. And when you move uncoordinated, you yank on tendons more to make up for your lack of coordination. So I think that's why those blowups happen too.
Interesting. So like if you did one session on track surface and then the next session you did it on concrete, like that would be something that could flare
It
your
could,
tendon.
yeah, but it's
Yeah.
also like tendon flare-ups and tendon pains. If you just look at the grand scheme of things, they're rare. Like the amount of jumps you've done in your life for you to have tendon pain, like only a few of them, or like the amount of athletes that you have seen, they've jumped millions of times and maybe only 1,000 times they've had like some tendon pain. Like it is very. So it's like it is probably good practice to be gradual in changes like that, but also being aware that like not everyone's going to get tendon pain, not everyone's going to get symptoms if you do something like that. But this is why I think you need to look at it and say, if you've never had tendon pain, you can kind of do whatever you want. Obviously, be smart with your training, but if you have had tendon pain in the past, the likelihood that it comes back is very high. So when you do something like go on a track to going on concrete, maybe you shouldn't, maybe you should try to be gradual about that if you're going to do that, if you've had a history of tendon pain. Jill Cook said this once, and it was fascinating. It was like, you should basically take your athletes and be like, this group never had tendon pain. They can just train normally. And this group has had tendon pain in the past. So we got to be more careful with them. So it's almost like you have two camps of people. Because the best predictor of future tendon pain is past tendon pain. So if you've had it in the past, it's likely to come up again. And if you've never had it, like, let's be smart with the training, but like we also don't have to be overly cautious.
Interesting. Interesting. So let's switch the topic a little bit. This was something that I was thinking about. So we had just I just interviewed Jonathan Surem, who's a French French triple jumper who's at Mizzou right now, and he just won NCAA's. And he used to have terrible tendon pain, like couldn't walk down the stairs type. And he got surgery on both of his knees, and he said that it helped him a lot with getting out of that pain and being able to perform again. What are your thoughts on knee surgery, and do you think that's something that people should look into, or what do you
Yeah,
think?
okay. So like always, conservative management first for like many months. If you go in and they scan your tendon and it's like, oh, we should go in with an X procedure, we should clean up some scar tissue or something. I don't think they do that anymore. I think current day they're going to see stuff on your scan and they're going to be like, let's send you to physical therapy and let's try out conservative management, because like you never want to just get surgery. Like you don't want to just be whatever, let's go open up your knee and do whatever. Like those are for people that have tried conservative management. Those are people that have not got better. Maybe they have something really bad going on in their tendon. So I'm not opposed to it. I just like, you have this case where this guy had success, and I have many cases where people have not had success and it made them much worse. So it's like, and I can also have people that did get better too. So it's like some people get better with it, some people don't. It's a risky thing to get surgery because they put you under, and then they could get it. You could get an infection. They could mess something up. So I was like, let's just be conservative and try good rehab. The problem is if they send you to physical therapy, it's often not good rehab, especially if you're a jumper and you're going to go to some physical therapy place where they're rehabbing like a 80-year-old lady just to walk downstairs, and they're going to give you the same rehab to go and do long jump or triple jump. Like they actually do that, and it's just idiotic. Like that is not, their rehab is not going to prepare you for the demands of sport, and you're just going to be in the tendon pain again. And then that really makes people think of the surgeries because it's like physical therapy failed me. It's like it didn't fail. It just was bad. It just didn't. There was a big gap. They did low intensity things, and your sport is high intensity, and they did not bridge the gap. They just kept you at low intensity, and that happens. That was my case. That's the case with a lot of people. Do you know what his surgery was?
I do
Okay,
not.
because like there's so many things that could be going on with knees and even with tendons. Like you could get calcifications in tendons. And sometimes they want to remove them. Sometimes they want to leave them in. Sometimes there's just like some scar tissue. They can do some minimally invasive things where they shave things out and then suck them out so like you can have a cleaner, quote unquote, cleaner looking tendon. Get rid of the scar tissue, but then you get surgery and the scar tissue probably comes back. So yeah, I think it always depends, but patience, like if you could have patience with the tendon and realize like it didn't get better in 6 months. 6 months is no time to a tendon. Like 12 months is also no time. Like it might get better in 18, it might get better in 20, it might get better in 36 months because that is the healing time that this tendon needs. I think that's kind of going to start coming around in the research that to really see changes in the tendon, positive changes in the tendon, it's not. I don't even know if it's happening in months. In a lot of cases, it's probably happening in a year time frame, many year time frame. So, yeah,
And that's talking about like the
the
structural
structural
part
part,
of it,
yeah,
not like the.
because earlier I
Okay.
was like, the structure and pain are not, you can't conflate the two, but it's not also to say structure doesn't matter because structure does matter, but we can't use structure to say this is going to be reflective of your pain. Yeah, and the structure of the tendon, there's this whole analogy of like the donut and the hole that like you have pockets of the tendon that are degenerative and unhealthy and they're never going to come back. So we're just going to build a bigger tendon outside of the damage. And I don't think that's true. I think there's been quite a bit of evidence that these holes within the tendon can actually fill in. Maybe not in like the rotator cuff, because the rotator cuff is not dealing with the loads of the patellar tendon and the Achilles tendon. But these holes within tendons or these degenerations, I think they can come back around and heal. And I think sometimes they just happen over years. They don't happen in weeks and months.
Interesting. All right. So to switch up the topic again, there are a lot of things out there on the internet, different protocols, different interventions to help out with knee pain. And some of it works for some people, some of it doesn't work for others. What are some things that you think are like misconceptions or things that probably don't push the needle much in terms of knee pain?
Yeah. Okay. So like probably like the big one during COVID was the ATG system, and that was kind of a competitor of mine. I haven't seen any ATG stuff in a long time, and now it's really went mainstream with like Huberman and the guy that's trying to live forever, like just a lot of those things, and it's really sensationalized, but it's like just common sense logic of like a 10-year-old kid of like when you're going to jump, the stresses and the forces going through the knee are so high, and if your rehab is reverse sled, it is so low that it's like there's a huge gap there you need to bridge. Now it is good to train the opposite side of the spectrum. It definitely is good, but like if your rehab, I don't want to speak for that rehab. I've never seen it, but maybe I feel like this is the case because I've had a lot of people not get better from it. If your rehab is just like reverse sled walks for like a muscle burn and then ATG split squats, which is like is not conducive for you to lift really heavy loads because you're going really deep into knee flexion and your muscle can't work that well. And then just these really different exercises that are sensationalized that are just a little bit different than other strength exercises. So actually, they're just worse strength exercises. Like a normal split squat is going to be better for your quadriceps than an ATG split squat because they're in a range where they're stronger and you can develop them better. And then like the reverse sled stuff is probably good for like blood flow, but anything is good for blood flow. Going for a walk is good for blood flow. And getting a quad burn, you can get a quad burn doing a wall sit. It's just these things have just been sensationalized. So I think the big issue I have with it, with what's out there with knee pain, is like that whole talk we had at the start of like the function and the pain is like we need to bring up function and we need to keep pain stable. And we need that function to bridge the gap. Like the function that you're training in the weight room or in your rehab, it can start with like 30 to 45 second isometrics, or it can start with really even lower intensity things like a backward sled, but it has to progress slowly over time. Like those isometrics need to turn into heavy strength with squats and with split squats. And then that needs to turn into store and release at like 25% intensity maybe, and then 50% and then 75% of jumping and landing. So like you just need to follow a logical progression of rehab, looking at the loads on the front of the knee and the speeds at the front of the knee, and let it settle by removing the high loads and removing the high speeds. Let the tendon settle by taking those away. and then regress at the very bottom and then just build it up over time. So I think if people wrap their head around that in terms of rehabbing their knee, which is stupid, simple, common sense, they wouldn't see something like a reverse dead mill and be like, oh, that's the key for knee health. It's like, I mean, it's just,
Or the
or
tibialis
that, yeah, too.
raises.
That too is just like, how did we arrive at that? Because it's, yeah, but that's it. That's it. It probably is good. It probably has a net positive because it got people excited about training. It got them excited about loading their knees. It's just that if we use a shred of common sense, it's like, how is this preparing you for the forces that are going through the front of your knee when you're doing triple jump? That you need that type of common sense because you've had people that have tried that training and they have not got better, and now they're even more confused. So maybe just a little bit better education, yeah, of the loads and the speeds need to be regressed and then they need to be progressed, and that's just how the human body works. Is you need to let things settle down and then you need to build them back up. Like that's just been, no one's going to challenge that and say that's wrong because it's just correct. And that type of rehab, yeah, the tibialis and the reverse sletna, that doesn't really, that's not even a thought, that's not even a thought when you're doing those things. You're just saying, I'm getting a quad burn and I'm getting my tibialis pumped. It's like, okay, that's the lowest IQ possible. We should raise the bar and just use a little bit more logic. So yeah, that's probably my issue with what's out there. I mean, I've done it too with the leg extension because I kind of sensationalize that myself. But I also admit that like some people do it and they get worse. I think some people have a knee that's just built in a weird way, or maybe they have a calcification or something, and it really pisses off their patellar tendon. But if they reach out to me, I'm not going to be so stuck on this one exercise. I'm going to say, if you've been trying this for a few weeks and a few months, and you can't even regress it down to the lightest load and find a pain-free position and get a positive response, just be done with it. Find a different quad exercise. So it's like, I'm not married to the leg extension. I know that it's really pissed a lot of people off. Let's just go back to the common sense, use that, and let's just find a different way to stimulate the quads and start to progress you back to sport.
And there was one thing that you said that I wanted to point out, and this will be like about our last question because we're almost running out of time. But you mentioned like heavy, like compound resistance training, like squats and stuff like that. So one thing I've noticed is that a lot of jumpers and a lot of track athletes are pretty allergic to the weight room, kind of the same in basketball. But for somebody who's not doing that, how would you recommend that they start doing that? How would you implement it? What do you think the like heavy resistance training plays? How does that play into knee pain?
Yeah, so it's pretty much the same as the isometrics. You're getting a slow load, so you're removing the speed, but you're getting a really like well tolerated load through the quads. Your brain is activating your quads. It's pulling on the tendon. It's probably getting a health effect of the tendon of the front of the knee. So isometrics do that, but slow, heavy strength stuff does the same thing. So like if you control the tempo down, you're getting the same type of. There's not much speed involved, so it's unlikely to really piss things off. And then you can come up slow as well, or you can come up kind of explosively. It's kind of just depends on the person and what they want to do, how their knee tolerates it. Because some people really bad knees, they need to go slow down and slow up. But I think what that does is like when you're doing an isometric, you're just holding a position. So that's really maybe quote unquote like non-specific, or it's really far away from the act of jumping, which is dynamic. So when you're holding an isometric position, I guess a progression of that is to take that isometric and move through the full range of motion of that exercise. So like you could be doing a wall sit as an isometric, and if you wanted to progress closer to jumping, maybe you do like a full range of motion squat, because now you're moving dynamically. And then you take that full range of motion squat and you turn it into a bilateral jump, like jumping at a low intensity and then higher and higher and higher. So like just this logical clear progression. I think that's what the slow heavy strength does, is like you're just moving through a range of motion, stepping away from the progressing from the isometrics to moving through a range of motion, because now you're getting your muscle to stretch like through a bigger range of motion. You're getting your tendon to strain through a range of motion, which is just more reflective of what's going on in jumping. And sometimes too, like people get so hung up on just doing isometrics that it's like sometimes you gotta like throw them to the wolves and be like, you're not making progress with the isometrics. Your pain is kind of just staying at the same spot. Let's just try to get you doing some through range exercises, and maybe your brain is going to like this. Maybe your brain is going to be like, okay, I can kind of coordinate things now, and my knee will start to feel better. Maybe it's just some stress that a person needs. So yeah, well, how can they go about it if they're not doing it? Was your question? That's kind of a hard thing, because like you're going to get acute soreness for any time you start doing something on lifting. So for someone like that who has no experience with it, I like there's a method called the 1 by 20 method for someone who's like inexperienced, who someone has never hit the weight room. It's you're doing one set of 20 reps on an exercise, so the load is going to be super light. So it's a low intensity, and you're doing one set, so like you just go all out in this one set, assuming the technique is proper. So it's like you can just do 1 by 20 on a squat exercise like 3 times a week, and just try to increase 5 pounds each time, and you're gonna be getting a good stimulus through your quads, through your whole legs, because squat hits your whole legs, and then do with other, like do it with a split squat, do it with the RDL, do it with some other thing for the posterior chain. It's like you can do it for anything, especially for someone who is not used to lifting. Do that 2 to 3 times a week with some good compound exercises, and you're going to be getting a good stimulus on the muscles. Like it's sure it's pretty low intensity, but like that's what you need if you're detrained from something, is you need low intensity. So they can do that, and then after like many months or maybe years, they can progress to something like sets of 10 or sets of 5, heavier weights. And yeah, but I think if you're a jumper and you're like allergic to that stuff, is like I don't know, isn't it kind of proven? Same with basketball, like you can really get better outputs if you really spend some time in the weight room developing your muscles and developing your connective tissues. And the weight room just gives you a novel stimulus for that. If all you do is jump and all you do is run, if you just hit the weight room, and it's another output thing, so your nervous system has to give a high output. So it's like, I don't know why people would still be resistant to that. Like just hit the weight room. And yeah, maybe it's soreness, maybe it's bad experiences. I don't know, I can't judge. So yeah.
And a lot of people just don't know the importance of it, so they don't think to do it.
Yeah. Dude, the weird thing, I think John Evans and Isaiah had this, and I never had thought of this. Is I think a lot of guys will use examples like, take Kevin Durant and be like, Kevin Durant couldn't bench press 135, and he's the best NBA player ever. And it's like you could bring the case of like, well, what if he could bench press 135? Would he be a little better? Maybe he would be a little better. So it's like any of these jumpers who are like, oh, I'm getting along just fine without the weight room, is like, well, could you be a little better if you did? Have you ever thought of that? So like, I think that's what people should start shifting their mindset of like, and it doesn't take much. I just said do one set of 20. Do a goblet squat. Grab a 25-pound dumbbell. Do one set of 20. And then next session, do 30 pounds. And then next 35. And in no time, you're doing 100 pounds with a 1 by 20. And your legs are going to be healthier, and you might be jumping better in like a few weeks or a few months. Yeah, just do it.
Yeah. And that one by 20 program, it doesn't really like take a lot out of you. You feel pretty fresh after. But I do remember those days Matt had me on the 1 by 20 program. That once you get to the end of those sets, it's pretty
Yeah,
brutal.
yeah, I can't be. Yeah, once you've done it for a long time, yeah.
Yeah. He had me on it for months. But I mean, it was a great introduction. It got me really strong in a lot of movements, and it felt great. So I think that's a pretty good starting point. Yeah, starting point for a lot of people who are new to the weight room. So I'd love to keep talking. This is all fascinating, and I think it's provided a lot of value for our viewers, but we are running out of time. So Jake, tell us where we can find you, Instagram, YouTube, anything like that, and any last messages you would like to leave to our audience.
Yeah, so it's Jake Tuura, last name Tuura. It's a Finnish name, so there's two U's in front of two U's back to back. So that's on Instagram, Twitter, YouTube, and then my podcast is Jacked Athlete Podcast. Recently, over the last couple months, I've just got not random, people that I look up to in the tendon community, and I just sat down and talked tendons with them for like an hour or so. So I've probably done like 20 shows recently. I don't know. And I'm gonna be having some more come out. So just trying to figure out what's going on with tendons and with tendon pain and tendon rehab. Although I do have it pretty well figured out of, I guess, everything we talked about here. Like it's really just what I've learned over the last 5 years of experimenting with things and seeing what works for people and what doesn't, and just arriving at what to me seems like really good, sound common sense. Like if someone refuting these ideas, I think these ideas could hold up to any criticism, because it's just common sense. It's just the human body and its physiology, and it's respecting timeframes of healing. Yeah, that's where people can find me.
Perfect. And if you are interested in learning more about the tendon stuff, his podcast is a great material for that. A lot of information on rehab, strength, and just all things knee health related. So yeah, it was great talking to you, Jake. We should do this again sometime. So if you wanted to follow us, I'm trying to do a new conclusion because we have to plug more stuff because we keep making new stuff. Okay. If you want more content like this, follow us on Instagram, YouTube, and TikTok. And if you want a little bit of content or If you want personalized help, you can go down to our Discord server where we can provide input on your jumps and give you some general advice on how to get out of knee pain, how to get out of different injuries, and overall improve your jumping. So thank y'all for watching. See you next time.